Hello, Miss Lawler. So here we go. This is my second attempt at our clean dressing change. And so I'm standing outside. I'm checking the orders. I'm seeing where and how often this change is going to be. I'm also looking at any pain meds and if they're having any clotting problems or if there are any medicine for that. So we've got our orders and now we're going to go in. We're going to knock. And say, hey, my name is Ashley. I've come in to do a dressing change. Can you tell me your name and date of birth? They're going to tell me. I'm going to verify by the wristband. Then I'm going to ask the last time it was changed, and hopefully they say the day before. So, the first thing we're going to do here is we're going to get everything set up. So we have our red bag, and we would roll it down and place it at the foot of the bed to make sure that it's not near any of our clean stuff. Then we are going to clean our area. Okay. Then we're going to lay our cover. Then we're going to have our 4x4s, which we can open and peel back. We'll need our paper tape and our normal saline. We're going to ask them if they have any allergies, and they said no. So now we're going to glove up. We're going to hand hygiene, then we're going to glove up. Now we are going to pull this back and we're going to start pulling the tape, and we're going to want to pull away from the wound. Then we're going to roll it over. Dressing's coming apart here. Lift up, look at it. So this is where we're going to do the coach. We're going to look for any color, odor, amount, consistency, and how well the patient tolerated it. And then we would document that when we finish. So I don't see any drainage, so we're going to put that back. We're going to roll it and place it in. And we're going to remove our gloves. Okay. And then now we are going to hand hygiene and reapply our gloves. And while we're doing this, we can take a look at the wound. And this is where we would do the Rita. And notice if there was any redness, edema, ecchymosis, bruising, any drainage. So our location is going to be on the abdomen. It's about 8 staples and it's about 22 centimeters long. There are no drains, so we won't have to document that. So now we are ready to go. So first we're going to start by removing the cap of our normal saline and placing it. Make sure it's like this. And we're going to lip it. So we're going to pour a small amount and bring it up so that way it touches the sides. Okay. Then we're going to moisten some of the 4x4s. Okay. And this is where we will start to clean the dressing. So we're going to make our little wontons. We're going to start in the middle and dispose. Then we're going to go the furthest one away. Dispose. And then last, the one closest to us and not dripping on the patient. Dispose. Now we're going to dry it. Going to pat. Okay. All right. So now we're ready to place the dry on the wound. We're going to pinch, make sure we don't touch what's going on the wound. Pinch. And one last one. Okay. And this is where we would want to tape it. So we're going to remove our gloves because it's difficult to tape. Okay. So we have our tape. We're going to do the window pane. And so this is where we could place the combine pad over the top and then tape that down to give some extra padding. One other thing that we're going to do with the dressing is we are going to label it, and it's going to have our name, date, and time, and where we would put that after we write on it would be somewhere at the bottom, and this lets others know when you have done it. So now we're going to make sure they're comfortable, and we're going to start cleaning up our supplies. Make sure they don't need anything, have the bed in the lowest and safe position, call bell within reach. And then the way that we would dispose of this would be by hospital policy. And so you want to make sure their room is nice and clean before you leave. And then before you leave, you would want to hand hygiene and then exit the room. And then back to what you would document, you would do the coach and the RITA, which would be color, odor, amount, consistency, how they handled it, redness, edema, ecchymosis, drainage, and the approximate. So location, number of staples, length, drains. So we had no drains, and we didn't have any drainage. We're pink, no edema. So we're doing pretty good. All right. Bye.